Secretary Caswell was appointed by Governor Cooper as the Secretary of Administration in April of 2021. She is the first American Indian woman to lead a state cabinet department in North Carolina history. Before joining DOA, she served as a Chief Deputy Secretary and Senior Policy Advisor in the Department of Public Safety, as the Assistant Director of the State Ethics Commission, and as a trial attorney in the Civil Rights Division of the United States Department of Justice. She received her Juris Doctor from the University of North Carolina School of Law, and I am super excited to set these women free.
Good afternoon, everybody. I'm super excited to have you all here this afternoon with us. This is such a great panel, and as Danielle mentioned, we have had 4 different Status of Women reports over the last 4 years that have been released. And so what we were hoping to do today, they're all pretty dense. If you haven't seen them, I would encourage you to go to our website and take a look. But our objective for today is just talk about some of the issues in those 4 reports without digging into, a lot of the specifics of them, because it's just so dense. And so we've tried to pull together, and I think we've done this successfully, 4 women in our state who bring richness in those particular backgrounds. And so with that, I'm going to start introducing them all. And the first is Associate Justice Anita Earls. Justice Earls was elected to the North Carolina Supreme Court in 2018 after running for statewide office as a first-time candidate. Before that, she was the founder and executive director of the Southern Coalition for Social Justice for 10 years and was a civil rights attorney in private practice and then Deputy Assistant Attorney General in the Civil Rights Division at USDOJ. Justice Earls earned her JD from Yale Law School, and she has an incredible background in the voting rights, police misconduct, employment discrimination areas, among other civil rights areas. And so welcome, Justice Earls. And I will tell you all that we have agreed as a panel that we're going to go by first name. So after I do these introductions, not being disrespectful to Justice Earls, but I know her well, and she has agreed that she will go by Anita for the panel today.
Thank you, Madam Secretary.
And so it goes both ways. So you all have to call me Pam. Next, we have Dr. Jada Brooks. Dr. Brooks is representing the health and wellness, by the way, category, and Anita is representing the political participation, although all of these women, as you will see, their background is so diverse that they could probably all talk about any of these issues. Dr. Brooks is a Carol Moore Ross Distinguished Term Scholar of Psychiatric and Mental Health Nursing at the University of North Carolina School of Nursing and an associate professor and lead faculty. She was recently appointed by Governor Cooper to the North Carolina Domestic Violence Commission, and she earned her PhD from Duke University and completed postdoctoral training at the University of North Carolina at Chapel Hill. Jada, thank you for joining us this afternoon. All right, next we have Lyric Thompson. Lyric is representing the employment and earnings perspective. She is the Senior Director of Policy and Advocacy at the International Center for Research on Women and serves as Vice Chair of our Council for Women here at DOA. She is a leading international expert on gender equity policy and an adjunct professor at George Washington University. Lyric is known internationally as an expert on gender equity policy, child marriage, adolescence and youth, and violence against women. And so we're excited to have Lyric Thompson with us. Next up, we have Adrian Spinner. Adrian is representing the Poverty and Opportunity area. She is the state organizing director for the North Carolina Housing Coalition, has been a longtime community activist in issues like housing, food insecurity, public education, and paid family leave. Adrian ran for public office in 2018 for the school board in Greensboro and is also a member of our North Carolina Council for Women. She is a graduate of North Carolina A&T. And let me tell you, I read all of these women's bios last evening, and they're all like 4 pages. And so that is a very condensed version of their accomplishments. But I'm really excited to have all of them with us today. And we have agreed that I'm going to ask some questions targeted to particular people initially, and then they have the latitude to certainly chime in. We really want this to be a free-flowing conversation that is useful for everyone who is listening. So I'm going to start out, Lyric, with you and talk about the pandemic. I really want to start with that. I mean, it's great. It feels like we're moving out of it, but we know that the pandemic has had a huge impact on women in a variety of ways. And so I want to start out by talking about some of those impacts and how we can address those impacts and the challenges that we have moving forward. And so why don't you start us out with that?
Sure, happy to do it. And thank you so much, Secretary. It's a delight to join you and the other esteemed panelists on this conversation today. And also thanks to Danielle and Sharnessa and the rest of the staff of the Council for Women, without whom we would not be able to do our work. And it's very good work, and I'm very excited to help tell the story of what we've found. I'm supposed to be, ironically, representing employment and earnings. As a nonprofit worker, I think we probably could have done better. But I will just tell you that our last report on the status of women in North Carolina employment and earnings predated the pandemic. And even then, it was a sad story to tell. We were going the wrong direction in terms of women's workforce participation, which had decreased from 2002 to 2016. And that was the data that we were looking at in the 2018 report. We did decide that the pandemic had so, as our governor so perfectly put it, exploited the inequities that we know exist in the state, that we needed to basically re-up our scholarship in this area and take a look at what was happening to women, and particularly women of color across the state, as the headlines were unfolding nationally. The story that was often referred to as the She Session, the impact of this pandemic pushing women out of the workforce as schools, daycares closed. And we know exactly who that impacts. Women have known this for millennia. Now I think policymakers understand as well that when that lifeline is cut, it is the women, and particularly in our essential workforce, women of color, who will do that work for low or no pay. And that's exactly what we saw in our state, as we did nationally in December of 2020. One of the most startling statistics that we saw was that 100% of job losses in this country were women. And if you dig a little deeper and look at that data by race, that was actually 100% Black and brown women. White women actually gained. And so that was one of the very important findings of our report at the time, which we launched in December of 2020, Exploiting Inequity, the Gendered and Racial Toll of the Pandemic on Women and Families of North Carolina, that a lot of the data that we do have, you can't tell that story. You can't tell the difference between white women and Black women, rural women, older women, younger women. And that when the data is incomplete, so is our picture of solutions. But we know a few things that can absolutely position us to move forward. And those have been the priority recommendations of the council. I should say many of them showed up in our pre-pandemic reports: Medicaid expansion, equal pay, universal pre-K, these sorts of investments in paid leave. The United States is one of the only countries in the world that does not mandate paid leave in some form. And North Carolina is one of a handful of states that does not have a number of pregnancy protections, paid leave protections, you name it. Our governor has attempted to address this through his auspices via executive order, and our reports have encouraged the legislature and state agencies not reporting to the governor, because our state's a little funky in that way. They don't all roll up to the governor's lead, as well as the private sector, which is of course where most women show up as workers, to meet or exceed his standards, which is to say I think 8 weeks of paid parental leave, 100% paid, and job protection. We'd love to see that number higher. We'd love to see it extended to elder and sick care as well as investments in universal pre-K, because we do know from the women we talk to across the state, as well as from our literature, that it is the school and daycare closures that impacted women the most. Thank you.
Thank you. Okay, that's a lot to unpack right there, because all the things that you talked about, childcare earnings. The one thing that you didn't mention, and it's Adrian, I'm going to give you a heads up that I'm coming to you next, because I'm curious as to how the pandemic, since you work in the housing sector, how the pandemic and the issues that arose in terms of job earnings for women, and particularly women of color, and the childcare issues, if you saw that transfer into the housing sector for those women.
Is that going to me now?
It is, yes.
Okay, absolutely. Thank you so much for having me and including me in this discussion. Yeah, I think the biggest thing that we saw is, like Lyric said, Governor Cooper at the very beginning of this pandemic uplifted the fact that the pandemic exploited a lot of issues that already existed for so many women and women of color. And these are systemic issues. And in order to uplift women, to promote women out of poverty and give them more opportunities, we're having to address systemic issues that have happened. And so, yes, it definitely translated into my work in housing. I mean, we saw this with the eviction crisis happening. There were folks that had to work in and out of the home, wages were stagnant. And unfortunately, even though wages did not go up for a lot of folks, housing costs did. And we are severely lacking in quality, affordable housing stock in this state and across the country. It is a crisis, in crisis mode, and people cannot afford safe, quality, affordable housing. And so in order to see those inequities lessen a bit, we're going to have to increase our housing stock, and we have to increase stability for folks and access for folks to get housing. And then if we are going to see women going back to work and returning to work full time, that cannot be done without affordable childcare. And right now, childcare costs more for some folks than in-state college tuition here. And that's a non-negotiable thing that has to be solved. We will not see folks going back to work, women going back to work, unless they can afford to have quality childcare for their families.
So what are some solutions for that? Does anybody have any particular insight on how we address, let's start with the childcare issue, how we address that issue? I mean, it's a huge problem, but how do we address it?
I'll jump in real quick first, because we've already started talking about it. Early childhood education and universal pre-K is a must. And I remember when my youngest started pre-K, we could not qualify for the North Carolina public pre-K that we currently have here. We made just enough money to not be able to qualify, but trying to send my daughter to a private pre-K was going to be a financial burden for us. So my husband and I worked full-time at home, and I sought the advice of some educator friends and ordered curriculum and workbooks for my daughter, and we homeschooled her while doing remote learning for my oldest, while both of us were working. And even though it was definitely a challenge for all of us to be in this house all day doing work and everything, we're lucky because we were at home and we had jobs that were very flexible to our work-life balance. And I know that so many people don't have that. So we have to have universal pre-K so that 4 and 5-year-olds, no matter what their economic status is, they can have quality early childhood education before K through 12.
Thank you for sharing that. Does anybody have anything else you want to add on that particular point? Because I'm going to turn us a little bit to health and wellness and the tie to economic stability. But if anybody has anything else you want to jump in on that. Anita, do you have something you want to say?
Well, I don't have policy recommendations around childcare, but what I will say about housing is that I also serve on the Equal Access to Justice Commission, and we did a study of legal needs across the state and needs for representation in landlord-tenant matters and eviction foreclosure. So for homeowners as well as renters is a huge need. And so I feel like the legal profession can step up to the plate in a variety of ways. Something like maybe 1% of people who end up in court over evictions are represented, and similar incredibly low numbers for people in foreclosures, and people without knowing what their legal rights are, without knowing what their options are, it becomes really hard to navigate that process. So I think the legal system can do a better job of providing access to justice by providing people with representation and legal advice.
Secretary, if I could just add one more piece on the child care piece. I think we saw that this was part of the response to the pandemic, and that the state did send out a number of child care stabilization grants to try to help some of these providers avoid going out of business, which is essential. I think we'd also like to see investing in care work as part of our social infrastructure. An investment in care jobs is actually yields greater job growth than in construction, which is a commonly accepted part of our infrastructure approach. Care jobs actually create two jobs, because you are creating a care job, you're opening up a job for the woman who was doing that work for free previously. So in terms of bang for buck, not only in our crisis response, but in terms of how we're prioritizing our annual budgetary investments moving forward, universal pre-K as well as support for care workers across childcare, elder care, and sick and disabled would be at the top of the list.
Thank you. And that's a great segue actually to the next topic that I want to talk about, which is health and wellness. Achieving economic stability, as you all know, is directly tied to our health and wellness. And so in our recent report, North Carolina was noted as having the highest uninsured rate. I'm sorry, not the highest, the 10th highest uninsured rate in the country. And I'd like for us to sort of unpack that and whether that is considered a key factor to both these economic pieces that we're talking about. It's certainly, I would think, a key factor to providing a healthier North Carolina. But what are the challenges in light of those, that high uninsured rate? First of all, what are the challenges that you see for North Carolina women in being insured? And then, the uninsured are often, I think, the people who work in, you talked about childcare, Adrian, who work in the daycare centers and who provide those types of jobs. Those tend to be the women who are uninsured. And so, the pandemic really, that was yet another way, I think, in which that was all exacerbated, because you had people stepping out of the workforce who are then, the way they may have had their insurance was through some of those various jobs. So let's talk about that a little bit. And Jada, I'm going to turn to you to start us off on that. What are the challenges you see for North Carolina women in healthcare and also in insurance?
Thank you, Secretary Pam. I'm honored to be a part of this esteemed panel of women to discuss some of the critical factors that impact the lives of women in North Carolina. And I think you're exactly right. There is a intersection there that is important, but I do want to highlight some of the data that talk about the women who are uninsured in North Carolina. And many of these women, or a large percentage of these women, happen to be women of childbearing age, which is the group or demographic that I study in my research. So much of what I understand about women is women within this age group. And it's no surprise, as you were alluding to, that the prevalence of being uninsured is higher among women in certain groups, including single mothers, women of color, low-income women, younger women, and then women who are pregnant or women who are in their postpartum period. Health insurance is important. It's critical to ensuring that women receive the preventative and medical care they need to achieve and maintain good health. Having public and private health insurance coverage provides many benefits that I won't go into, but we all know about access to and use of preventative and routine health care, the quality of health care, and how that's impacted, as well as health outcomes. And there are many disadvantages for women who are uninsured, which again sort of are the opposite of what I just mentioned in terms of inadequate access to care, lower standards of care, or lower quality of health care. There's unmet needs that women have due to the medical care or the cost of medical care. And then women in this age group or demographic are also less likely to participate in or receive preventative services such as mammograms and pap tests for screening. And there have been some public programs that show evidence of reducing the rate of uninsured women, which include Medicaid expansion, and that includes pregnancy-related Medicaid. And this has been shown to improve the state's ability to address another challenge that is related to the pandemic and economic stability, which is mental health. And as an enrolled member of the Lumbee Tribe of North Carolina and a member of the North Carolina Domestic Violence Commission, I also wanted to take a moment to highlight the challenge of intimate partner violence and domestic abuse. These issues, many of them are oftentimes not singular. They often occur together. For intimate partner violence and domestic abuse, that is higher in women of color. Again, I have a lot of data on Native women who are affected by violence and face higher murder rates than the typical individual in the nation. I don't want to go into a lot of detail around that, but there have been some policy initiatives and landmarks at the national level that have been brought to our attention and given national attention to address the issue. But oftentimes what I've seen is that this isn't or hasn't been highlighted in North Carolina, and the ties of economic stability as well as the uninsurance and the everyday lives of women, including exposure to violence. All of those things can really compromise women's health. And, that's just sort of on the surface level. There's so many other things that contribute to the health of women in North Carolina, but those are some of the major challenges that I've seen recently that have been exacerbated by the pandemic.
Thank you, Jada. And you briefly mentioned Medicaid expansion. Is that the answer? Is that the answer to addressing the uninsured issue in North Carolina? And Lyric, I don't know if you want to talk about that, or Jada, if you have anything else that you want to add on that, or anybody else as far as that's concerned.
I don't have the answer to that. I don't think it is the answer. I think it's a part of the solution. I think it will help, close the gap or some of the insurance gap and provide women with some coverage that would have hopefully a positive impact on their health outcomes and quality of care. But in terms of addressing the other challenges and issues in women's lives, I don't know that it would be the be-all, end-all solution for that.
And just to piggyback on that, from a coverage perspective, absolutely. I think that, and again, pre-pandemic, one of our top recommendations was Medicaid expansion for the state, because there's just absolutely no reason that we should not be providing care to another 600,000 North Carolinians, full stop. We're also just leaving federal dollars on the table, which doesn't make sense either, particularly if we are staring down potential recession and other economic concerns, and also just the humanity of it. We wanted to also flag a couple of other areas in which there are some coverage gaps that women face in the state of North Carolina. If you are receiving pregnancy-related Medicaid, you are automatically disenrolled as soon as you deliver. It would be very easy to just automatically then enroll you in family planning Medicaid. But instead, we're pushing women out of the healthcare system at a time that they arguably need it most, if you're talking, and particularly for Black women whose maternal mortality rates in this country are just astronomical. You're pushing women out of coverage at a time that they arguably need it more than ever. Finally, we wanted to see mental health coverage in our various benefits in the state. Our methodology for our pandemic report was slightly different than our other reports, which is to say that in addition to the literature and the statistics and the data that we mined, we also just talked to women across the state about how this pandemic was impacting their lives. And to a person, the profound effects on mental health in terms of caring for or not being able to mourn folks who are sick, folks who are dying, and just the compounding stresses of having to deal with pocketbook issues, trying to educate your kids, the story that Adrian told of being school teacher and remote worker at the same time. Yes, that is a resource to be able to do, but also it means that you are facing just being pulled in 1,000 different directions, being stretched and ground to the point of death. But I think in terms of the violence piece, I really would want to emphasize that we need to be investing every bit as much in prevention as we are in response. And that's where we as a society don't tend to do as good of a job, and we're arguably not doing a very good job on the response piece either. There was some encouraging news in the Violence Against Women Act reauthorization federally this month, which does include particularly prevention efforts, as well as some important justice, retribution, and response for Native American and Alaska Native tribes, which have always been handled outside of the federal system, and therefore there was just impunity for particularly white men coming to reservations and attacking women, and not being able to be held to the full extent of tribal law. That's changing for some tribes. So there's many more tools in the toolbox that we could use, but yes, absolutely, coverage is one that is a no-brainer.
All right, thank you. All right, I'm going to turn to our latest report, which is entitled Poverty and Opportunity. And the findings of that report were that there are huge disparities in North Carolina. It doesn't come as any surprise to anyone, I'm sure, in terms of the women who are in poverty, that the problem remains persistently among women of color, and also among single mothers. And so North Carolina ranks 38th in the country for the percentage of women living in poverty overall. That number is at 13.6%, but the rates, again, vary. There's a great disparity between women of color and white women. In North Carolina, households headed by single women with children are more than five times as likely to live in poverty than households headed by married couples with children. So before we leave this discussion of employment and earnings and health and wellness, and I know all those things really tie into poverty, but just I do want to throw it out there. What can we do in North Carolina to lift more women of color and single mothers out of poverty? And Adrian, I'm going to start with you on this one.
Thank you. Yeah, as I've said before, and my other fellow panelists have spoken about, these are systemic issues that COVID merely just highlighted. And so we're going to have to go back to a foundation to change structural issues, and system change has to happen. We have to have equitable policy that helps to uplift the most marginalized of us. And a lot of folks have the mentality that if you're talking about equity and you're talking about policy that specifically helps, say, a woman of color, that means, somebody else suffers. And that's not the case. It's not pie. Just because you're helping someone doesn't mean, someone else gets less. I think that if you uplift the most marginalized folks in society, then we all rise. Our entire community benefits. And so the recommendations that we had in the Poverty and Opportunity Report, along with in the COVID report as well, include some of the things we've talked about, the care economy. And that means paid family leave. That means universal pre-K and affordable childcare. It means treating essential workers exactly like they are essential. And these workers were folks that before the pandemic were looked down upon, did not have health insurance, did not have a livable wage. And then we saw with the pandemic just how essential they are. And it's not just folks that are working in retail and food production, restaurants and things like that. It's also childcare. And so we need to invest in childcare facilities. We need to be giving more folks opportunity to start their own childcare businesses. And we need to be paying teachers and early childhood education workers a livable wage and what they deserve to be paid. And then as far as investments in housing that I've already mentioned, we need to be working on a more affordable and quality housing stock. I've seen a lot of poor quality affordable housing concentrated to only certain parts of town. And so we need more racially and economically diverse neighborhoods, which means that there should be an affordable housing option for somebody no matter where they live. And there should be a variety of places that they can be safe and raise their families. And we need to be making sure that historically and currently underserved neighborhoods, low-income neighborhoods or communities of color, that we're seeing more quality housing, we're seeing better code enforcement, more protections for tenants and homeowners, rehab assistance, and that's things that can come from federal dollars to help low-income folks, elderly folks be able to rehab their homes and keep their homes up to date. We need more investments in energy efficiency appliances and making sure homes are energy efficient. That's not just good for your family, but that's also good for the environment. It's good for our health, especially people that suffer things like asthma that are exacerbated by mold and other poor quality aspects of housing. And housing costs do not need to be raised as long as our wages aren't being raised. As long as we do not have a livable wage for so many people, we do not need to be seeing housing costs going up. And so that's going to mean more protection for homeowners and for tenants, folks that are renting their homes. So yeah, it's a lot of things, but it's just a matter of uplifting marginalized folks and uplifting women. And I heard a quote one time that said, if you invest in women and children, you're investing in people that invest in everybody. And so if you're really working hard to uplift women in this state, women across the country, in our local communities, then you're going to see folks that care about the entire community and our families, because we want to raise great families and have peers of our children be benefiting as well.
Great, thank you. Does anybody want to add to that before I turn us, because that's a really good segue to political participation, but I don't want to shut down any more conversation about lifting women out of poverty, if anybody has any last thing that they want to add to that.
Just a quick plug for our recommendation to raise the minimum wage. North Carolina has ranked last for the last 3 years running, dead last, 52 out of 52 states, plus Puerto Rico and the District of Columbia, in the Women's Wage Index, Women Workers Index. Part of that is the fact that we haven't raised, we're still operating at the slightly over $7 minimum wage, slightly over $2 minimum tipped wage, and tipped worker women do constitute the majority of our tipped workers in the state. And so this is the floor as we see it for women workers, for essential work, for care work. And as Adrian already said, we should be investing at that at greater levels than certainly we are now, but even that $15 standard, but it would certainly be a start. I also would note that North Carolina doesn't offer any of the workplace protections for women Pregnancy protections, that is one that the governor has tried to do through executive order. Pay transparency. There's zero statutory requirements on equal pay by race or gender in the state. So there's really a lot of tools that we could use to improve the situation and at least not be dead last, but hopefully be one day the best place in the country for women to thrive.
Thank you, Lyric. I appreciate that add-in. Anita, you look like you have something you want to say before I move. Yes or no? If not, I'm going to turn us to, okay. Okay, great. Thank you so much, Lyric, for adding that. The minimum wage is really a critical issue that needs to be addressed. And I'm hopeful that we may get there very soon. Okay, so I'm going to turn us to political participation because, you know, the more women that we can get into elected roles who would give us the opportunity to change some of these laws, that would be helpful. So let's talk about political participation. In North Carolina, women are slightly more likely to vote than women nationally, but we are not well represented in executive and legislative elected offices. North Carolina has only ever had one female governor, Governor Perdue, and there are currently no women representing North Carolina in the U.S. Senate. Only 15.4% of North Carolina's representatives in the U.S. House are women, and in our North Carolina legislature, 20% of our state senators are women and 28% of our North Carolina representatives are women. So we clearly have a lot of work to do. Let's talk about what we can do in North Carolina to better encourage women to run for elected office. And Anita, I'm going to turn to you, and then I'll go to Adrian, since both of you have run for office. Let's talk about, let's let you start us out with that conversation, Anita.
Great. Thank you so much. And I'm really glad to have this focus on political participation, because I do think, as someone who did voting rights work for 30 years, that voting and participating in the political process and electing candidates of your choice to represent you, those are all fundamental to all the other issues, and to having a seat at the table, to having your voices heard, to having your perspective. So what can we do? And I think the single, in my mind, the single most effective thing would be to make it financially possible for more women to be able to run for office and then hold office once they've been elected. And so I think that's another way in which all these things are related, because when more women are in poverty, when women's wages aren't the same, they don't have the same wealth, so there's a wealth gap as well as an income gap, then they don't have the same capacity. You know, we think of political participation as voting, but that's really only one tiny piece. And all the other elements of political participation, including working on campaigns, running for office yourself, engaging in all the activities that hold your elected officials accountable. When you have less financial resources, you have less ability to do all those things. And there really is, I would put forward an evidence-based case for why having resources would increase women's ability to run and win for office. And I would draw on the experience of judicial candidates. At least in our court, the North Carolina Supreme Court, which has been in existence for 203 years, there have only ever been 9 women on our court. But the thing that from 2004 until 2012, we had in our state public financing of campaigns for statewide appellate seats. So for Court of Appeals and State Supreme Court. And during that period, we actually had 4 women on our 7-member court at the same time. And similar increases in the number of women running for and elected to the Court of Appeals. And so I don't, this is not a political science causation argument, but there's definitely a correlation there. Definitely a correlation in terms of the availability of public financing. So women who wanted to run for a statewide seat, which is a daunting prospect, to run statewide, this is a huge state. And these days, so in 2018, I was advised that I would need to raise $3 million to have an effective campaign. I think the numbers are even bigger now. And the only reason I was able to do that was because I could leave my job and work full time as a candidate. And that's a huge ask. So as I have talked with other women about running for this court, one of the biggest barriers is, well, I have kids in school. My family is dependent on my income. I can't afford to take a pay cut while I run for office, even though my office is one that actually has a livable wage, right? State legislators don't. So you have to figure out how you are going to continue to bring in some income while, that our legislature has a lot of retired people who don't need to work. But I do think there's a correlation there between financial ability and ability to effectively participate in the political process. But I do have some other ideas as well, because I think that in some ways our state is very fortunate to have some of the tools of women's political participation. So we have organizations that train women on how to run for office, which was crucial for, at least for me, to learn how to be a good candidate, how to message and do a stump speech and all those good things. And we have, and groups that support women candidates. So there's some infrastructure in the state, but we're really missing the pipeline. And one way that we could do a better job, I think, of creating pipeline is to make women's participation on boards and commissions then actually lead to elected office. And so there's been some careful look at the extent to which women are underrepresented on states, boards, and commissions. And it's particularly when you look, so the Women's Forum did a study in, I believe this was 2018, they identified 24 key boards and commissions. So things like the Transportation Board and the ones that make some of the most high profile and most important decisions for our state, that women are currently underrepresented on those boards and commissions, and a greater attention hopefully will begin to create more of a pipeline for women to step up to the plate and say, I have had a leadership role in this setting and I'm now ready to run for public office and represent a constituency.
Thank you, Adrian. Before I turn to you, I want to do two quick follow-ups, Anita. One is, you mentioned that there are a number of resources out there for women who may be listening who are interested in those resources. Where do they go to? Where's a repository? Do you Google how to find support to run for office in North Carolina?
Yes.
Where do people go?
So there are groups that will put you on their mailing list for their candidate training, and also for so they do trainings not only for people who've made up their mind that they want to run, but people who are considering it. So Lead NC is one such group. Lillian's List is another group. And it's absolutely true that I think certainly for judicial seats, but I think more broadly, people who have studied this say that that women don't put themselves forward, right? Like they're waiting for someone to ask them and encourage, well, maybe not waiting isn't the right word, but when you talk to people who've run for office, men are all ready to say, I'm the guy, I'm gonna run. And women are more or less likely to just jump in there and put themselves forward. So I think, to the extent there are a lot of structural barriers, and I don't mean to minimize those, but to the extent there are things within our own control, I would urge people to think about, have there been other times and ways in which you can put yourself forward. And yes, you can Google running for office in North Carolina and sign up for a listserv and get some ideas. And the other really great way I would submit is working on a campaign. and working more directly than just signing up to do door knocking. But actually, my campaign ended up being all women run. Like my campaign manager was a woman, my staff were women, and it was hard to find. And that made a difference. That made a huge difference in how I was able to message what I stood for, and everything about my campaign was so positively impacted by that fact. But in the world of political operatives and the people who support people who run for office, there aren't as many women. So so getting engaged deeply in a campaign is a great way to get a vision of what it involves, and then how you can be engaged.
The other thing that I want to follow up on is you mentioned the importance of participating on boards and commissions, and it's one of the things that I'm a little bit passionate about, and trying to get women appointed to boards and commissions. And it's also one of the things that I'm super proud of with this administration, because there is hands down, Governor Cooper's administration has appointed more women and more people of color than in our history. Right now, 49.5% of the board appointees on our over 400 state boards and commissions are women. That is huge. That is awesome. And I love that. And, you know, we can do more. But what I want to say is that because I always love to provide people with resources, and I tell people this all the time, that the governor's office on their website actually has a tab for boards and commissions where you can go and look through the whole list of boards and commissions, see what the vacancies are, see what they do, see what interests you. And then you can self-nominate to actually serve on a state board and commission. And there are thousands of people literally who are serving at any given time. And so I encourage people all the time to look at that website, look at that list, see if there's something you're interested in, and then self-nominate. And if you know someone who works in state government who can support you in that effort, then that's great. But I know that the state is always looking for great people to serve on a board or commission. So that is not an unattainable thing. You know, there are just so many, it's so diverse, the opportunities for that. So I did want to mention that as well. Adrian, turning to you for political participation, since you have run for public office before, do you have anything to add to what Anita mentioned?
Thank you. Anita's answer was so thorough, it's not much really to add. I would say that a lot of the initiative that Governor Cooper and the state took to make boards and commissions so diverse, that needs to be translated to the local level. So that's number one. Local governments, whether it's in more urban areas or rural, need to be having that same initiative to make sure that there are diverse voices at the table. Again, investments in care economy and helping women across the state is going to help women that want to run for office. And as a stay-at-home mom that was asked to run, I was my youngest sole childcare up until I ran. And so that did not change once I was running. And so she, at 3 years old, came with me to a lot of events and came with me to the polls. I mean, she was there when I filed. She was tossing things out of my purse, and everybody just thought it was the cutest thing. And so I capitalized on that, like, look at this great kid. But, and I'm sure a lot of parents that run for office do that. But just helping women that are running, if you have capacity to help with childcare for a candidate or someone on a candidate's staff, then do that. If you can do play dates, I feel like there should be support for women and working class folks that want to run for office. I've seen many times that women of color running for office are not seen as viable, or they're not good fundraisers, or not winnable compared to their counterparts. And that mentality needs to change if we want to see more women of color in office. Campaigns should be funded and supported that are women running. Those campaigns should be supported and funded just as much as men. And then for the legislature, yes, the low pay of that, of being on the legislature, and then of course you're not getting paid while you're trying to run, is difficult. I have considered running for the legislature. It's something that I have thought very deeply about doing, but I literally could not afford to, because the pay cut from what I'm making now to what I would make serving there is, I mean, it would not help to hold my family up, and it would be a severe financial burden. So that does need to change. There needs to be more respect for work-life balance. Not everybody on the legislature should be an old, retired person with, not having young children at home. There should be more parents. There should be more educators. There should be more working class folks serving in our government and at policy making tables. And so in order to do that, your short session actually has to be a short session. And you shouldn't be calling a legislator back for a midnight vote. Like that, those things don't even make sense. And so we have to be more caring to people with families, to younger folks that are not retired, if you're wanting to see representation.
Thank you. I appreciate that. And those are really important points. I knew that this hour was going to fly by, and we're not out of time yet, but we're definitely winnowing in there. So I have two other questions that I want to ask all four of you. And so I want you to keep your answers brief when I go through these. As women, we are constantly juggling family. I mean, for me, I've got kids at home and an aging parent who needs my help, community involvement, church, career, all, we're just all juggling a million balls in the air. So tell us briefly, what are your secrets for managing all of your competing priorities? And Jada, I'll start with you.
Personally, I found that self-care is the most important of all of those, or to be able to provide me the ability to manage successfully all of the things that I have to manage. Without that, I find that my emotions are unstable. I'm not as focused. I'm not as committed to my work. I'm, oftentimes have a lot of negative self-talk. And so for me personally, given over the past 2 years, a lot of transition in personal life experience or personal life situations that have occurred, I found that without self-care, I'm not able to give my best to all of the things that you mentioned.
Lyric.
So I'm going to say investing in care, and I like self-care very much. But I just had a pandemic baby. Baby Helen is 6 months old last week, and I'm newly in the last few weeks back to my paid occupation. And so I would say that it was an interesting time to be looking for daycare and or nanny service. I am fortunate that my mother-in-law takes care of her 1 day a week. And I know someone had asked about grandmothers. Thank goodness for our grandmothers. Helen still has both of hers. And grandmothers do end up becoming someone who is relied on to support that family care work for so many families, if you are fortunate enough to have one. But I would argue that this is not, our little tips and tricks, while they may get us through day to day, is not the conversation that we need to be having with the audience of policymakers and powerful people that are finally understanding and attuned to the issue of care. We need to be making our societal investments in this area. Care work is work. And whether we are paying for it ourselves or doing it ourselves, that is work that needs to be valued, that needs to be paid for, and that needs to be protected in terms of it is often some of the worst working conditions, least likely to have benefits, et cetera. That is starting to change now, and my hope is that that is something that we're able to professionalize and truly value moving forward.
Great. Thank you. Anita, how do you manage all the things that you have?
Yeah, the only answer I can give is when I get support. So whether that's support in the workplace, and so I think often actually women in the workplace don't get the same kind of support that a man gets, but so support in the workplace or support at home, but it's or in volunteer activities, like that's what's made the difference. And so I guess I would say to someone who's struggling, the one thing you can do is like, don't be afraid to ask for help, find where you can get support, because that's the only way I can do it.
All right, Adrian.
So for me personally, one, Google Calendar has been my angel for the past couple years, prioritizing my physical and mental health, and then setting healthy boundaries. And I know a lot of women feel guilty by saying no or delegating tasks, and letting go of that guilt, which is easier said than done. I get that. Has really helped me, just especially when it comes to my volunteer work. Learn to set those boundaries as to when I take calls or when I answer an email or when I volunteer my time.
Great. Thank you so much. So finally, we started this with a note that the Council for Women has released 4 reports in a 4-part series of Status of Women reports. And so we talked about a lot of those issue areas, but I would really encourage those of you who are on, if you have not seen those, to visit our website and take a look at them, because they all contain a lot of very interesting statistics, and more importantly, recommendations, some of which have been talked about today, for how we move North Carolina forward and how we improve the status of women in North Carolina. So I'm going to end with us doing another, giving each of you the opportunity to give, for the group who is listening, what would be your charge to the folks who are listening to this panel for helping lift up women in North Carolina? And so I'll go in the reverse this time, and I'll start with you, Adrian. What would be your charge, briefly?
Sure. Fund and support women of color that run for office, and support the local advocacy work of women of color in your community if you have the capacity to.
Okay, Anita?
I would say make sure that women's stories are told and that women's voices are heard. That's what I think is missing.
Great. Lyric?
Your work is work. Value that work and pay for it.
I like it. All right. And finally, Jada.
I would say that I would charge the audience with funding or supporting programs that provide resources to uplift women in their mental health and improving their mental health. So,
Super. All right, well, we are going to wrap up, but I would be remiss if I did not give you all one last opportunity. If there's something that you feel like we missed, that we didn't cover in this conversation, I mean, for me, I feel like I have to say that we are at a historic time. It's a shame that after 233 years of the U.S. Supreme Court, we just now have our first African-American woman who has been nominated for confirmation. And I'm very hopeful that Judge Ketanji Brown Jackson will be that person. But, you know, I struggle myself with being super excited about that and the fact that that is happening, and then realizing that it's taken us 233 years to get there. And so I'm always in a constant personal battle of like not being bummed about how long it's taken us to get there and being positive about the fact that we are there. And so I'm going to end on an optimistic note, and I'm positive that the fact that we are there, and it's a really exciting time for that to be happening. And so if there's any last nugget that any of you feel like, I really wanted to say this, then you've got 30 seconds to say what it is you wanted to say.
I'm just going to jump in. I want to say we haven't talked about the importance of mentorship. And so I just want to lift up how much I value that. And so for any stage of your career, to both be looking for mentors and to be looking for women that you can mentor.
Awesome. That's great. Lyric, you had something you wanted to jump in and say.
I just wanted to note that we talked quite a bit about women's political participation as leaders, but less about the way that most women participate in our political system, which is as voters. And I wanted to thank the violence survivor that shared her testimony in the comments and said that we need to make sure that we are being conscious about sharing information about address and those sorts of things, because that can be challenging for folks who are living in fear of violence or in very real experience of violence. And so in our pandemic report, we do have a number of recommendations about protecting the safety and integrity of our civic engagement, where most women are showing up. So thank you for that, and we will move that forward.
Adrian or Jada, you guys good? Okay, awesome. So before you click off, before you close, let me just say, first of all, thank you to our 4 panelists. You guys are amazing. You're my idols. I really appreciate you taking the time to be with us. I could go on with this for like easily another hour, but probably longer, especially if we were sitting in a room across from each other. We could talk about these issues for a really long time, but alas, we are out of time, except for we are now going to show the video that is the intro for the latest of our reports, which is on poverty and opportunity. And so for those of you who need to scoot, by all means, you can feel free to drop off, but I'm going to ask our technological folks to show that video. And when that is over, we will be finished. And so thanks again for everyone who joined us to view. And I'm sorry we didn't get to any questions that were in the chat, but the conversation was going along so well. I just didn't want to break our group. In North Carolina, women are 51% of the population. We are the majority. Despite this fact, our value is often overshadowed and marginalized. Women are our unsung heroes. We are juggling work responsibilities and managing businesses, families, and careers, often at the expense of our own well-being. Hi, I'm Pam Cashwell, Secretary of the North Carolina Department of Administration. It's my great pleasure to present the latest report on the status of women in North Carolina, poverty and opportunity. This is the 4th and final report of this series that provides key data and recommendations to help us create a brighter future for women in North Carolina. This Poverty and Opportunity report highlights the status of women at the intersections of health, financial well-being, and education. These factors play a major role in determining the overall economic security of women and their families. While many women have made great strides toward economic equality, not all women have equal access to these opportunities and the support they need to thrive. This leaves many women struggling to achieve financial and economic security.
Data for this report was generated from 4 key indicators: health insurance coverage, educational attainment, business ownership, and poverty rates. Health insurance is a critical component to the economic well-being of women. When it comes to women with health insurance, North Carolina falls below the national average, particularly for women of color. Women in rural areas were even less likely to have health insurance.
Women are more likely than men to have at least a bachelor's degree. However, progress in obtaining a 4-year degree has not been the same for all groups of women. Black and Latina women are less likely to have access to 4-year colleges with better funding for students and higher spending on instruction. In fact, almost half of North Carolina counties, less than 20% of women aged 25 and older, have a 4-year degree or higher. An increasing number of women are starting their own businesses. However, most of those women-owned businesses are sole proprietorships with no employees.
In my professional role, I have the benefit of working closely with women in business and minority business owners, and I happen to know firsthand some of the challenges that they've dealt with when it comes to scaling their businesses or being able to compete for businesses. And I know that some of the challenges relate to limited startup capital, being able to access resources from funders, or even understanding how to do paperwork when it comes to being certified. Creating and providing equal opportunities for women in education, employment, pay, and other areas examined in these reports are the needed catalysts for change for women. Improving these areas will help women to thrive and achieve economic security for themselves and their families. The steps towards advancing the quality of life for women in North Carolina requires an investment in public policies that center on race and gender.
Thank you all for joining us. I appreciate everybody's time.